So patient selection for rilzabrutinib is going to be somewhat dependent on the regulatory approval, right? What the label says, but in general, I mean, certainly for the patients that were enrolled in Luna 2 and Luna 3, those patients that have failed a number of prior therapies, I think rilzabrutinib becomes a very attractive option because the response rates overall in those two studies were quite good for that heavily relapsed refractory population. And the drug is oral, which is obviously a nice aspect to it. Again, I think getting more information on use earlier in the course of disease and in earlier lines will be very, very helpful in potentially introducing this drug in the disease course a bit earlier. Now, in terms of adverse events, most common adverse events that were shown in the Luna 3 study were gastrointestinal in nature. And so there is some diarrhea and there are some other gastrointestinal side effects, which were mostly mild and tended to not result in treatment discontinuation or anything like that. So I think that's something to recognize when starting the drug, that it is a tyrosine kinase inhibitor and that it is associated with certain adverse events that drugs like thrombopoietin receptor agonists are not associated with.